Um, I'm not an expert in pain management as such. Okay, there are pain management clinics at the hospital and pain management consultants, but I'm just a general practitioner with a wider interest in how to stay well without medicine and how we can help our own self. How can we manage ourselves? Because as we all know, if you look at the NHS the way it is, it's hard to get to see anyone. You may have all experienced this, but then anubhav hase ke atyana health system upar rely thava એવું first went into medicine in the 1980s in the late. The system was much more accessible. Appointments were easier. The flow from patient from GP to hospital was easier than it was now. Everything is over stretched, and so resources, even though the knowledge has increased, to get anything done these days, it takes a longer time and sometimes very difficult. So it's in everybody's interest that we take our own self-responsibility, because health apna જ હાથમાં છે. Even though health system is there, but the health system should be used appropriately, because it can only cater for emergency things and certain things. It's overloaded, overwhelmed with people. It's high time we all take a little bit of responsibility, and that's what this whole program is about. Today's topic is, fibromyalgia. This group is for fibromyalgia people, and fibromyalgia is a very, very difficult condition. Since in medical ways, people don't know why fibromyalgia happens. કોઈને ખબર જ નથી કે કેમ થાય છે fibromyalgia. અત્યારના fibromyalgia is another name for it, is widespread body pain. Okay, આખા બોડીમાં pain થાય. That's what fibromyalgia is. Fibromyalgia is basically people are in chronic pain, which means long-term pain. Okay, લાંબો time સુધી દુખાવો આવે પણ જાય જ નહીં, અને day-to-day basis ઉપર pain હોય. Now, these people, Atyana, prevalence કેટલું છે? How many people get this? Currently in the UK, it's estimated about 5% or more, up to 9% maybe. Globally, there are sufferers of fibromyalgia, between 5 to 9%. They're figures I've found. So it's like 1 in 20 people, roughly. Okay, and બીજી ટાઈપના pains તો ઘણા બધા છે, and sometimes there's an overlap between fibromyalgia and other pains. Overall, you can get pain from arthritis, you can get injury pain, you can get so many things, but fibromyalgia pain is a very specific long-term pain. That's the definition. It's a chronic pain, and આખું શરીર દુખે, whole body pain. Okay, and when you look at the person, people look normal, and mainly it starts in people in young people, like 30s, in their 30s or up to 50s. It starts at a middle age group, and mainly they are ladies. So when you look at people, when they come into the doctor's office or they see somebody, they look normal. You can't see anything wrong. There's no swelling, there's nothing to identify, like you would in arthritis. Like sometimes sojo hoy ke injury થઈ હોય તો તમને લાલ થઈ ગયું હોય, સોજી ગયું હોય, when movement કરો તો દુખે. પણ આમાં છે ને કાંઈ દેખાય નહીં, પણ માણસ કહેતા હોય કે મને સારું નથી, મને દુખે જ છે બધું. પછી આપણે ડોક્ટર્સ લોકો શું કરે કે બધું ચેક કરે કે ચાલો ઓકે, પહેલા તો physically check કરીએ, પછી આપણે blood test કરીએ. We do blood tests, and every single blood test we can do including inflammation markers. So we can do blood count, thyroid, CRP, plasma viscosity, everything comes back normal. All the blood tests come back fine. And then you say, okay, it hurts me here, it hurts me here. Usually when you touch somebody with fibromyalgia, they're in chronic pain. They're in pain. That is the definition, fibromyalgia. And અમને ઘણી વાર સમજ જ ન પડે કે આ કેમ થાય છે. Even vitamin D levels check કરીએ, B12 check, કાંઈ ના આવે. Iron level બધું normal આવે. એટલે it's a mystery. કેમ શેના લીધે થાય છે? So then, because we can't figure it out, we generally, most GPs refer to a rheumatologist, a specialist in pain. Okay, and there's a long wait for this. Right now, it must be over a year to wait for a rheumatologist to see you. And once the rheumatologist sees you, again, they'll go through the checks, they'll check you out, and they'll do maybe some other new tests. But once everything is exhausted, all X-rays, scan bhi કરી શકે body નું, કાંઈ ના આવે. Even joints માં એકટી જગ્યાએ કાંઈ wrong નહીં આવે. And then they diagnose you with fibromyalgia. And that is the process. It's a long-winded way, but you can see the frustration. Medically, કોઈને સમજ જ નથી પડતી આમાં. Why is this happening? It's a big question mark. So I'm going to unfathom it. Over the years, one of the biggest things that's puzzled me is fibromyalgia. And it's one of the reasons I actually took up alternative remedy. I looked into alternative ways of handling health, alternative remedies. And, I went on a journey to look for answers, because medically, these people, there was nothing you can treat. And normal painkillers, most people say, okay, if you've got pain, just take Panadol, which is fine. This is what most people tell you to do. Doctors will say, just take paracetamol, ibuprofen. Now, even ibuprofen, paracetamol, even codeine, strong painkillers, even like codeine or even morphine, do not work in fibromyalgia. These people are suffering, and nobody, even regular painkillers, even the strongest painkillers, does not touch the pain. Because people regularly came back and told me, "Mane saru nath thatu. I don't feel any better." So how do you get around it? And it's been a dilemma, and it's one of the reasons I actually looked into more alternative remedies. And I will share some of the things I have found that can help you straight away. And અત્યારના, over the years, more and more research has been done. And compared to 30 years ago, when I first trained, right now there is far greater understanding about fibromyalgia. And the greatest news anybody with fibromyalgia is, for even 20 years ago, કોઈને ખબર નથી કે આ ક્યોર થશે, because most people suffered their whole life. Once you are diagnosed with fibromyalgia, previously in medical fields, we all know, and lots of doctors will know this, can cure નથી any medical ma. And people used to suffer years and years and years, right till their last day. But now I can honestly tell you, there is a cure. Okay, you have to want it if you want to do this. And I'm going to explain how this comes about in a few minutes. But there is 100%, even medically, recognized that people can reverse it. However, we have to understand that થાય છે શું કામ પહેલા, કારણ કે અત્યાર સુધી કંઈ કોઝ જ નથી ખબર. એટલે થાય છે શું કામ? હવે ઘણી અત્યારની રિસર્ચ પ્રમાણે એમ કહી છે કે fibromyalgia હોય ને, તો there are many triggers towards it. According to research, અત્યારના ઘણા જણાને genetic causes હોય છે. It's very strongly related with genetic certain genes. અને અમુક familiesમાં હોય છે, તમારા parentsમાં કે કોઈને હોય તો તમને pass on થવામાં ઘણો બધો chance છે. Like they've done twin studies where twins બે એક સરખા હોય, એને 50% chance છે કે એકને હોય તો બીજાને હોય. એવું બધું છે. બીજું શું છે કે relatives માં તમારે હોય તો 8 times chance છે કે તમને થઈ શકે. So there's a strong genetic link. But despite that, there's a very good chance of getting better. and we'll go why this is, because ઘણી વાર છે ને આપણું અત્યારનું understanding pramane fibromyalgia, in fibromyalgia what happens is your body is in constant pain, right? But there is no injury, there is nothing physical or anything identifiable, but your body is actually what they call it is it's overreacting. It's like an oversensitive system. It's central sensitive syndrome, they call it. What does this mean? Research pramane evi રીતના છે. What it means is you inside your body, those people who have fibromyalgia, they have more of certain neurochemicals which are triggering parts of their brain which gives you pain, and it's happening on a day-to-day basis regularly. So what happens is your brain and nervous system is on fire, it's on high alert, as if you have some physical injury. Your body is reacting all the time like that, and you get they found that you get increased levels of certain neurochemicals, such as there's names for them, such as substance P, which is a pain producer, substance P, then glutamate, and then enkephalins. And these are all neurochemicals which are higher in people who have fibromyalgia. એટલે આપણી chemicals, આખું biochemistry આપણું change થઈ ગયું હોય છે, which આપણો brain જ એમાં on alert હોય છે, આખો વખત fire થાય રાખે છે. એટલે pain નું જે center હોય છે એ fire થાય છે. અને જે pain ઓછું કરવાનું જે chemicals છે, the chemicals that slow down the pain are reduced. And these are things like noradrenaline and serotonin. These two factors which help pain or regulate pain are reduced. And so the pain is not inhibited. Tamaru pain થાય છે પણ ઓલું stop નથી થાતું because chemicals એના balance કરવાના નથી થાતા. And it's ઘણા ને, and the interesting thing is જેને chronic pain હોય ને એનું level આપણા અંદર જ આપણી own pharmacy છે. There's a pharmacy within our brain which produces pain relieving agents such as opioids. Okay, આપણે like morphine આપણે ગોળી આપીએ છીએ, પણ આપણા brain માં એ type નું morphine type of chemical થાય છે, which helps you deal with pain. And the interesting research shows that in fibromyalgia the level of opioids or morphine like substances are very, very high, and છતાંય people pain છે. And the reason why that is if opioids are higher, but એનું જે receptor હોય ને, જે opium નું level high છે, પણ એ cell માં જઈ નથી શકતું. જે receptor site હોય, each cell has a receptor, and the receptors are reduced, and that is why people are in constant pain. You've got increased neurotransmitters that cause pain and reduced receptors that actually help to deal with the pain. હવે અત્યારના મેડિકલમાં તો if you go to a doctor right now, even in this day and age, most doctors will listen to you, they'll take your history, they'll check you, and પછી કહેશે કે okay, once they've diagnosed it, or if they can't diagnose it, they'll send you to a specialist, and then they will start you on anything that will help you with pain. So if all the painkillers don't help, the next thing the doctor will do is to give you things like antidepressant medicines, because they think it's all in your mind, and to a degree it is, but we'll come to that in a minute. Okay, but they give you antidepressants. They can give you even other agents like amitriptyline, which actually reduces certain signals to reduce pain, or they can give you things like pregabalin tablets, and a lot of people are on these medicines on a daily basis. Amitriptyline is often given at night time, like 10 milligrams, and it helps you sleep, it helps you relax, and for that reason it helps you deal with the pain, but it doesn't cure the pain. And pregabalin is similar. Pregabalin reduces certain signals going to the brain, so it numbs certain pains like sharp shooting pains, so it help back pain, type of pains, chronic pains, but ochu thai if they take pregabalin. And also tramadol, which is a very strong painkiller. That is the only painkiller which is shown to sometimes help people fibromyalgia. Like medical ma આ ત્રણ વસ્તુ છે, amitriptyline, pregabalin, and tramadol. Now, after this, and antidepressants such as citalopram or sertraline, which are called SSRIs, okay, serotonin, they enhance the level of your serotonin. Now, our medical route che. Now, medical route is very, very, very limited because, you know, as a GP, I've seen people with fibromyalgia, many people, and none of them have got better. Even though they take the medicines, they're all suffering all the time. So I've looked into answers. Help kari shagai. And there are answers, okay? That's the good news. The current thinking is that fibromyalgia has got three components. It's bio, psycho, and social. It's a biopsychosocial problem. Bio means body. There's body changes. That means hyperactivity of certain, like we just mentioned, enhanced neurotransmitters, enhanced changes in your biochemistry that definitely happening. There are psychological factors that are a big factor in this. And there are also social factors. Social, family network કેવું છે, આપણે એકલા છીએ કે કઈ આપણી સાથે છે, or have we had any relationship issues? All these things matter in dealing with fibromyalgia. Now, you know, આપણે handle કરવું હોય તો there are the only way you can cure. I mean, I have seen people get better from this. I've read about this and I've looked into this a little bit. Main reason why you are in pain is it's not something wrong in your brain or it's not something wrong in your body. Okay, physically, doctors can check you out and they can assure you that kai wrong nathi tamne. But pain sena karane thai chhe. Why you're in pain is that it's the things that are happening on a day-to-day basis, the way you process things, that the input that you're putting in your brain is what is triggering the pain. So that's a very fine line to understand. Habits amuk apdi hoy che ke apdu thinking pattern amuk hoy che is the day-to-day thinking process as well as day-to-day habits that are triggering our pain response. And it's happening automatically. It's not like nobody wants to do this consciously. You know, in the best will in mind, nobody wants pain, right? We know that. Going to pain nathi jotu. But આ કેમ થાય છે કે આપણે unconsciously કરીએ છીએ. That is why this is happening. And the only way I can tell you that if you are serious about getting better, and I can 100% tell you you can get better, is that you have to sit quietly and analyze yourself. Introspect કરવું પડે. આપણે જાતને time આપવો પડે. We have to give ourselves time and see what is it that am I thinking about every day? What is it, the words I'm using? આપણે બોલીએ છીએ શું અને વિચારીએ છીએ શું? એ બહુ જ critical છે, બહુ critical છે. Now sometimes આપણને કોઈ દિવસ આપણું શું ચાલે છે મગજમાં એ કોઈ દિવસ વિચાર જ નથી કરતા. And you have to step back a little bit and sit quietly and introspect. The only way is to look at yourself as an outsider and listen to what you are saying. તમે તમારી જાતને જુઓ કે what are you saying? What are you talking? Because the words have an impact on your psychology directly. You know, આપણને ખબર છે કે આપણે શું વિચાર કરી આપણા પિક્ચર્સ શું બનાવીએ છીએ આપણા મગજમાં એ બી બહુ ઇમ્પોર્ટન્ટ છે. So, like for instance, you know, આપણે કંઈક you know, આપણે સારું થવું હોય તો આપણે સારા વિચારો હોવા જ જોઈએ, right? In your body we have 5 bodies actually. એક જ શરીર નથી આપણે. There are 5 components to getting better. First is your physical body, which we can see. આપણી physical body માં આપણે ખાઈએ છીએ શું, exercise શું કરીએ છીએ, એ બધું important છે. So eating right, eating natural foods, eating whole foods, eating next to nature. That's very important. Secondly, આપણું pranic layer છે. Second body is your prana, which is your breathing. We need to breathe slowly and appropriately. ઘણીવાર આપણે ફાઇબ્રોમાલ્જામાં કે કોઈ બી પેઇન પેશન્ટ્સ હોય ને, એ લોકોનું બ્રીધિંગ જ સરખું નથી હોતું. Sometimes they overbreathe and they are anxious all the time. Sometimes they shallow breathe. You know, આપણે breathe તો કરીએ બધા, પણ એનું breath બહુ shallow હોય. And these also trigger the stress response. So if you can do slow breathing, regulated breathing, like pranayama exercises, deep breathing, belly breathing. I'm sure તમારા ગ્રુપમાં આવું બધું કરતા હશે, because yoga and reflexology and everything is in here. Slow deep breathing and regulated breathing can help a lot. Even I know for sure that તમે જો breath તમે slow breathe કરો, if you count in, let's say count in for the count of 2, 1, 2, and then you breathe out to the count of 4, which is double the time. So breathe in 1, 2, and then you breathe out 1, 2, 3, 4. So you breathe out double the time, and then you keep doing that. You breathe in 1, 2, and then breathe out 1, 2, 3, 4. And if you do this for a few minutes, breathing in and then double the time to breathe out, keep doing that. That actually flips your system into parasympathetic. It calms you. It's a calming breath. And doing this for a few minutes on a regular basis every day can actually reduce your oversensitivity and can help your pain. Simple breathing thing જ પહેલા તો થઈ શકે છે. So that's your second body. So I said there are 5 bodies. One is body, one is the breath, the prana. એટલે આ પ્રાણામાં આવે છે. પછી third is your mind. That's the third body. And mind is the biggest influence on your body. Whether you know or not, આપણું જે વિચાર છે, વિચારની શક્તિ છે, એ highest effect કરે છે body ઉપર. So આપણે શું વિચાર કરીએ છીએ day to day? આપણે જો happy thoughts હશે, સારા વિચાર હશે, પોઝિટિવ થોટ્સ હશે, તો આપણું શરીર સારું હશે, હેલ્ધી હશે. પણ જો આપણે ડાઉન ફિલિંગ ઓલ ધ ટાઈમ હશે, કે નેગેટિવ આવતું હશે, કે વરીઝમાં હશે, ટેન્શનમાં હશે, all these things, the negative thoughts have a big effect on your body, and then they slow down your energy. This is one of the reasons you're in pain. So you have to analyze your thoughts and you have to analyze what you speak. કારણ કે આપણે બોલીએ છીએ એ જ આપણું થશે. એટલે જે ન જોતો એવું ન બોલો, જે જોઈએ છે એવું જ બોલો. And this needs training. Okay, I can't do this for you. Everybody has to do this themselves. Self management છે આખું. To get better, you have to take self responsibility, and your thoughts are the biggest responsibility you have. To keep positive, to keep optimistic, to be grateful for everything. You know, આપણે thank you જ ખાલી બોલતા શીખશું ને in day-to-day things. Just saying, waking up in the morning and say, thank you, God, thank you for everything. Think of 10 things that you are thankful for. Thankful for breathing, thankful for your eyes, thank you for your ears, thank you for your legs, thank you for your arms, thank you for your food, thank you for your digestion, thank you for everything. Start saying thank you, energy goes up, and that helps you to stay okay. So that's another way, is being grateful all the time, changing your thought pattern. Fundamental chair. And third is the fourth body, like we said. So third is your mind, and the fourth, really important, is your intellect. હવે intellect is your decision making power. એટલે આપણે પહેલા decide કરવું જોઈએ કે મારે શું જોઈએ છે. You have a choice. તમારે પેઇનમાં જ રહેવું છે કે તમારે સારું થવું છે. પહેલા તો નક્કી કરવું જોઈએ, મગજમાં આપણે મૂકવું જ જોઈએ કે ના, મારે સારું થવું જ છે, ગમે તે થાય, મારે હેલ્ધી થવું જ છે. જો એટલું આપણો નિશ્ચય હશે તો we can get better. If you command your mind, you make the choice to be better, you can be better. That is half the battle. That sometimes we are not even sure what we want. And sometimes we don't focus on being well. We have to have that strong determination, strong choice to say, yes, I'm going to get better. I'm not right now, but I'm not going to focus on my pain. I'm going to focus on my health. So you've got to shift your focus from being in pain to being in health. Even though you've got pain, you've got to imagine that you're in health. How you were when you are completely normal. How you were, how you'd like to be, how you were when you're absolutely fine. So that is how you've got to make the decision and change take that power in your mind to say, I can do this, and I can be healthy. So that is a choice is a huge thing. Okay. And we have to be happy and content and make small steps every day towards this. And finally, the fifth body is Ananda. And that is all about being happy. So we have to choose to be happy. And if you could only choose to be happy, your energy will go higher and higher, and your pain will slowly take control. It will go away. It will literally disappear. So, nowadays there is with the technology, there is I can tell everybody that you can actually download an app which helps you in fibromyalgia, and the app actually takes you through these processes. It guides you into how you can make small changes day to day in your thinking, in your words, in your attitudes, in day-to-day things. It even gives you meditations to calm your mind down and to put you in a better state of frame, And you will, if you do this, people who are doing this and using this app regularly, after 1 or 2 months, you can actually get better. This is what a lot of the research is showing nowadays. And the app is called Curable. You can download it on your phone. It's got a little blue thing. I mean, I don't know if anybody has used this. I'd be interested to know if any of you know about this. But the app is called Curable, Curable, and it's in the Apple Store. You can download it. It's brilliant. I've actually looked into it, and it's really fantastic. There's initial bit is free, but then to have the benefit of it, it's like your own personal coach. Okay, therapist you can pay to see a therapist, it'll cost you a lot, but this is like your own therapist. And honestly, if you use this app, you will get better. It's brilliant. You can spend hours on it, but તમે થોડું 10-15 minutes દરરોજના follow કરશો ને. Curable. Okay, I'd strongly recommend it, and I don't know if anybody's used it, but I'm strongly recommending it. And if fibromyalgia, get this app. So it's like a little it's a little blue thing. Actually, you won't be able to see it, but you can download it from App Store. Okay, and the other things are so these are the principles is to do things for yourself in a positive way. Apri own responsibility levi pade at the end of the day, because medically there's not much on offer, to be honest with you. But 100% I know you can get better. There's a technique also that I can share with our viewers here today. I don't know if you're interested or how we're doing for time, Nehaji, but if you want, there is a thought-filled therapy technique, which takes about 5 minutes to do to help anybody with pain. It's one of the alternative things I've come across in my time, and it's very easy to do, and anybody can do it. Basically, it uses your own, it's basically trying to balance your meridian energies very quickly to help you control some of the pain. Even if it's chronic pain, it helps. It also helps with acute pain, but this is particularly good for chronic pains of any sort. Do you want me to share this?
Yes, please, Deepaji. That would be wonderful to do it with.
It's a pain controlling technique.
Yes.
You're right, or you want to have a breather, question answers?
I
Do you
think
want me to
we'll
show
have
you
a
this
quick
technique?
go with the technique first, if we can.
Okay, yeah. So these are, it's a very, very simple technique, and it's extremely effective. I mean, if you want to do this with you, I mean, normally you do it on a one-to, you can do, this is a self-help technique. You can do this on your own. You don't need anybody else, okay? But I've done it with patients in my own office. I've done it with people that come, family and friends, they come with acute pain. And 9 out of 10, the pain will go down without any painkillers within a few minutes. But obviously chronic pain, people with chronic pain, it can take several sessions to get rid of the pain, but you will definitely get a slight shift in your pain. You'll usually get a reduction in the current pain level very quickly. So let's do it. So first of all, you have to, whoever's got pain, if you want to follow me, just do it on your own. Sit quietly with your feet on the floor and sit upright. And then just focus on your pain, wherever it is on your body. Focus on your pain and quietly reflect at the intensity of that pain. So just focus on it and give it an intensity between 1 and 10. So you do it in your own mind. You give yourself a number of how your pain is right now. Okay. So once you've focused on your pain, everybody done that? Focus on your pain, and then get your hand and just tap on the side of the hand here, like this. It's called the karate point. So side of the hand, just tap it like 5-10 times, like this. You can do it either hand, one hand or both hands. So tap it on the side of the hand whilst thinking of your pain. Okay. Then next you press below your nose. The nose and lip ni upar na vachlo point and press there and focus on your pain. And again, tap it with 2 fingers 5 to 10 times, like that. Okay, think of your pain. And then you tap below the chin, below the lips, so just above the chin, in the middle of the chin here. And again, just tap it and focus on your pain. And then you get your back of your hand, the third little finger and ring finger, back of the hand, between the ring and the little finger in the middle here. You see this point? This is called the gamut point. And you just tap it with your 2 fingers there 50 times. So about 30 seconds. You tap it for about 30 seconds, okay? So just nice, gentle, firm taps with 2 hands. You can hear me clap. It's like a clapping sound, like this, 50 times. Okay, I'm checking on my thing about 30 seconds. And you can do it the other hand as well if you want. Just tap it. You don't have to count precisely. 30 seconds. So a lot more taps on this point. We're trying to balance the energies. The nice firm taps between ring finger and little finger in the back of the hand here. Okay, you can see just like that. Right, very good. So once you've done that, you tap underneath the collarbones. So, apdi collarbone hoy, the collarbone, like the clavicle bone, just 1 inch below that, right in the center here. And yeah, you tap both sides about 5-10 times below the collarbone, like 1 inch below it, and not right in the middle, but 1 inch out to the side. So here, okay, it doesn't have to be precise, but just below the collarbone, 1 inch. Just tap it there 5-10 times. And you can take a few deep breaths if you like. Okay, and then once you've done that 5-10 times, again, you tap on the back of this hand. Now this time, keep tapping. And I'm also going to involve eye movements. So what you do is close your eyes for a second, then open your eyes, then look down to the left, just look on the floor down to the left, then look down to the right, just move your eyes down to the right, then look up and then just once, And then look up and move your eyes in the opposite direction once whilst you're tapping. Okay, so eyes clockwise and then anti-clockwise, and keep tapping. And then you're tapping 5 seconds, and then count 1, 2, 3, 4, 5. Okay, count hum. Now, this looks silly, but what it's doing, it's accessing every single corner of your brain. By moving your eyes, you're accessing different locations in your brain. By humming, you're accessing the right brain. By counting, you're accessing the left brain. Okay, and then once you've done that, you can rest. And now focus on your pain. How is your pain? Now, most likely your pain, you know, the number that you had at the beginning, that should have gone down. Tell me if that is the case or not. Because 9 out of 10, that is what happens. Just doing this sequence. It's really, really simple. Your pain, Ghana pain, please tell me, because we'd love to share this. But this is just one cycle, and you can do this again. If your pain hasn't shifted, you can repeat this cycle. Okay, so you can start again tapping on the side of your hand, below your nose, below the chin, and then back of the hand 50 times, collarbone, yeah. Then back of the hand again with eye movements. So close eyes, open eyes, look down, look left, round, round, hum, count, hum, that sequence. And then back to, and that's it, that's finished. And that's the second cycle. And you do this several times, and I can assure you, very often your pain will come down. So this is a handy something I'm teaching everyone.
Question, please.
Certainly. So, you know, it's a simple thing to do, but to be positive, you know, we have to fundamental to anything in healing is you have to raise your energy, our mental energy, as well as our psychic energy. Raise karvi jo, apne jo sulk, apne focus karvo joye. So tell yourself every morning when you wake up, I love myself. I love myself the way I am. Accept yourself. I accept myself the way I am. I forgive myself the way I am. You have to tell your mind day and day in, every morning for a few minutes, I love myself, I accept myself, I forgive myself. And then I love everybody, I accept everybody as they are, and I forgive everybody. And if you start doing this, it's on a regular basis, loving yourself, forgiving yourself, accepting yourself, looking into ways your mind thinks and stopping the negative words, stopping the negative thoughts. Doing these practices, this simple little pain technique, and you know, there's so many things, and maybe download this Curable app. And that is your sort of self-help tutor, if you like. I can assure you, if you follow these techniques, they're really, really simple, but anybody can do, and I can tell you and assure you, you will get better. There's no question about it. Tamari energy shift thase, positive thase, tame happy reso, and do all these things. Then slowly, slowly, your habits will change. Once your habits change and you get new habits, pain will not even be a problem anymore. You will be happy and free bird. You'll be normal. This is what I want to share with you, and I hope ke badane like and if please share your own experiences. There's so many other things you can do as well, but I'm telling you in a nutshell things that I found most useful. Okay, so thank you so much, everybody.
Deepa, we had some signal issues in between, so the humming.
Yeah. Was I cut off for a bit?
Yes, the humming was a question, and we missed that humming when you explained. Can you
okay.
that bit part?
Humming, basically, when you tapping on and thinking of your pain and humming just for a few seconds, you can hum any sound, doesn't matter what you hum. Humming activates the right brain. It's like singing. you're activating the right side of your brain, the creative brain. And counting, you're activating the left brain, the logic brain. And the eye movements, you're accessing all parts of your brain. You're accessing different parts, which all, if your brain is in sync, your brain signals will be better, and you will not have this oversensitive brain that happens in fibromyalgia. It's basically over triggering of your brain. You've got to calm your brain down. So obviously things like meditation, breathing, very important. And this technique I found really fantastic, because you don't need to do any other practice to do it. Anyone can do it. You can do it even sitting in a bus, or sitting, doing something else, just watching telly. You can do it even, and it'll honestly make you feel better, very instantly. So it's a technique from thought field therapy. I learned it from Dr. Roger Callahan, who is the author of this technique. And he's written many books on it and cured many people of chronic conditions, including pain, as well as depression, anxiety, all sorts of things. Okay, so yes, we can have question and answers, or if anybody wants any views on it, please share. Very please ask.
Repeat the name of the technique you showed us.
The name of the technique?
Yes.
Yeah, it's thought field therapy. Thought field therapy by Roger Callahan. I can send you, I've got a little YouTube video on it. I can send to the, if you have a WhatsApp group, I can send it there. I can send it to Nehaji and she can post it to you.
Yes.
It's a 10-minute video, exactly going through what we've done just now. A lady can, somebody's videoed it on here. So when I learned it, I learned this about 20 years ago. There were no videos at that time. We didn't even have iPhones. But this is now, everything's on you can download it on Google now. And I've got a YouTube video on this, 10 minutes. Anybody can learn it. It's so simple and it's doable, And the Curable app, I can honestly, it's brilliant. The guy who's invented it, he said it's an American app. They literally talk to you like a person is talking to you. And they nudge you to do this, do this, do this. What else is your issue? What else do you want to focus on? What is it you're thinking of? That is, what is the meaning you're giving to your pain? Sometimes it's the meaning we give to our pain that is the problem. We may think our pain is very, very serious, and we're always in this fight and flight mode because we are focusing on just the pain. But this app will actually help you in very simple ways to get you out of that cycle. It's brilliant. It only costs about £45 for a year to download. So that's not, it's quite affordable, £45. And it's your one-to-one tutor, as it were, or coach. Brilliant. So, yes. Any more questions? I'll forward you the links for this, okay? And you can also get the app from curablehealth.com. Curablehealth.com is another website for it. It's on the App Store as well. Mm-hmm. Okay, anything else? I mean, there's many things we can do, but I'm just sharing some of the best things I know about how to handle fibromyalgia and what can be done.
Sorry, what is it called? Curable?
It's app called Curable. It's a little blue. You can, just like any other app, you can get it from the Apple App Store. Curable, C-U-R-A-B-L-E. Called Curable. And it's an app for chronic management, for management of chronic pains like fibromyalgia. Specific for fibromyalgia or any chronic pain.
Excuse me, Deepa.
People got better using this. So it's very, very good. This is the latest technology. And I tell you, brilliant. It's I wish I knew this 20 years ago. So many people would have benefited. But anybody that walks in my door now, I give them these tools. These are what you can do to help yourself to get better. You don't need to come to doctors, honestly. Fibromyalgia, doctors are rubbish at. They don't know how to treat it. Even they don't understand it. But
excuse me, doctor.
Wider interest. And nowadays, Google, you can check this out. You can find it yourself. I'm sure there's other good things like this as well. But this is one of the best things I've come across.
Excuse me, doctor.
follow.
Is there a YouTube that we can follow
For what?
for the fibromyalgia and all the exercises?
I don't know.
You mentioned YouTube.
Bits and pieces from different places I've found, but the
Yeah.
Curable is an app. I don't know about
Yeah.
there's a YouTube about it, but the Curable thing is a self-help, one-to-one basis. It targets, and you even get access to a therapist there.
Okay.
It's within the cost of the app. It's so good. It specifies according to your need, because everybody's pain has a different meaning. Everybody's life situation is different. You can't generalize in a situation like this, but most people with fibromyalgia, they've had some trauma in their life. Even though outwardly they all look normal, and when we ask people, my experience is most people, when they come to the GP, they say, oh, we don't have any stress. A lot of people tell me that they don't express their inner, and that's the biggest dilemma actually for us, because we can't understand why this is happening. But this app might help you if you can read English. It's all in English, you see, but if you can follow English, it's a brilliant thing. It'll give you it'll give you the latest science on pain and how to tackle it. And 100% you will get results with it.
Thank you.
Even I think there's something like, if you don't get any results within 60 days or something, they even give you your money back. Okay, that's what I recall, but I'm not sure on that one. But they give you, many people will get results within 1 to 2 months. That's what they're claiming, which is not
Doctor,
bad.
Do you use
years and years?
Mm-hmm. Please, do you use any herbs for fibromyalgia?
Sorry?
Do you use any
I can't
herbs
hear you.
for treating fibromyalgia? Hello?
Deepaji, do you use any herbs to treat
So
fibromyalgia? If I'm an...
Yeah.
The herbs?
Do I use any herbs?
Yes.
No, I don't know about herbs. Sorry, I'm not trained in herbs at all. That's not my forte. I'm sorry. I don't know much about herbs. I'm sure there are herbs else. I haven't used it. No, sorry.
Hi, can I just ask you something? You know, the technique you just showed us, how do we find that on YouTube? Sorry.
This is a it's a biopsychosocial problem. Okay, you have to understand, it's not just one thing. You have to look broader, not just the body. You've got to look at your thinking, your brain, your psychology, as well as your social interactions. How are your relationships? Are you good with people around you? Have you got any grudges with somebody? Because if you don't get on with your mother or father or somebody close to you, it may be a reason for why you're in pain. There are many causes. I'm not saying it's just that, but each individual has to focus and look at their particular issue. And these are just some of the things that could be. It's close social interaction. Many people are isolated. And I know a few people in my surgery who have got fibromyalgia, but they came from India. They were absolutely fine when they were in India, but soon after coming to the UK, after like 2-3 years, they were in chronic pain. But they were fit and normal. There was nothing wrong with them. Now, how do you explain this? But there's obviously some connection for them to move away from India and coming here. And it's that sort of thing. How do you deal with that? The person has to come to terms with their current situation the way it is. And that only you can do. Nobody else can do it for you. You have to act and come to your own balance and acceptance on that situation. Yeah, so it's many things like that. Some past trauma that has triggered this. And then you have to unpick what's happened in the past. What happened before your fibromyalgia started? Very often a few days or a month or so, or a little while just before your pain initiated, something may have happened in your life. And that will give you a clue what to focus on. Maybe you've just got married, or maybe you've moved somewhere, or maybe you've had an accident. Some people, a road traffic accident or a whiplash injury triggers fibromyalgia. And then because they can't forget the trauma, the pain lingers on. So what you have to do is to understand your situation, try and accept the trauma and let go of it, and then your pain will relieve. That's how it is. Okay. Any more?
Yes, Dr. Deepa.
Please.
Yeah, would you?
Wants this, some question.
Would you? Yeah. Sorry. Would you prefer paracetamol or the herbs or the Ayurvedic remedy for the fibromyalgia?
Did you listen to the earlier part of the talk?
Hello.
Because none of this work for fibromyalgia. I talk earlier. Hello.
Hello.
That's my experience. Physical things don't often work. It's a mental. You have to deal with the mental issues to get cured.
Okay. One of the lady you asked.
Physically, that's.
Hello.
Hello, doctor.
Yeah.
Hello, doctor.
Who's?
Doctor here. Can I speak? Hello, doctor. Can I speak?
Please,
Doctor.
please do so.
Doctor.
Okay.
I have tried in the past amitriptyline and morphine and everything, and none of the things worked in 2004 attack. And then since then, I always in a pain. But recently, it's triggered again in April. And doctor just gave me nortriptyline. I haven't taken it because I'm thinking to cure, heal myself in a natural way.
Yeah.
Huh.
So the medicines are temporary help to deal with it, but you have to, the work, if you want cure, is inner work. Only you can do. You have to do your own inner work. I'm giving you some tools that you can start with. This, maybe download this curable app. It would be brilliant for you.
Yeah.
You'll be able to understand your happening in your body and how to unpick it.
Okay. What about the vegan diet? Because with fibromyalgia, I had a problem with constipation, and I have been staying raw vegan until 4 o'clock. Sorry?
Have you had any release in your pain just doing this technique just now?
Not me. I have tried, but not me, because I think I'm in a chronic pain right now.
You didn't try it? Okay.
Yeah, it didn't work for me. I tried. Yeah.
Okay, so you tried. Yeah, fine. So if it doesn't work, you've got to look for other answers. Yeah.
Yeah.
But
yeah.
it's a lot of work, but you can do it. There are even, there are private therapists as well that help with chronic pain. I know there's a lady called Marisha Pierce who does a lot of work on chronic pain, and she's she does a hypnotherapy type of treatment called rapid transformation therapy, and she has cured many people from fibromyalgia in the UK as well as worldwide. She's based in the UK. Ni best therapist and she's cured many people with fibromyalgia.
What is her name?
Marisa Pierce. There are many download.
Yeah, there is no good internet connection.
Pierce, P-E-E-R-S. Her technique is called rapid transformational therapy. And it takes about 90 minutes to do. I'm not trained in that, but I've read up on Marissa Peer. She's brilliant. I fully respect what this lady does. But many people have said they've become cured from years and years of chronic pain once their brain was reprogrammed using hypnotherapy, which this lady does, and you can learn it even yourself. But it takes about 90 minutes, 1.5 hours, or up to 2 hours at the most. And many often just one session will reduce your pain, or you get out of it because you reprogram your brain patterns. But those are some tools that I've come across through the internet, and I've been following this lady for 3-4 years now. Brilliant.
That's what happens.
Really.
That's why they're recording.
And she teaches. There are courses and things she teaches as well online. You can even download some of her things if you want to learn it. But I'm not trained in it. Okay, I've not had the time to do it. I would have done it if I had time.
Okay, thank you, doctor.
Okay.
Sorry, can you just say this lady's name again? Thank you.
Marissa Peer. Marissa Peers. You can put it in the chat if you want.
Yes, please. Thank you.
Yeah. I'll put it in the chat. Yeah.
Sorry, doctor.
You can find her on Google.
Sorry, doctor. I've just missed your earlier session. Just joined. Is this session been recorded, and can we go back to listen to?
No, you'll have to ask the organizers. I don't know. Is it recorded, Nehaji? I don't know. Many people want to know about it.
I have put in the details in the chat box. It has been recorded and it can be shared. So if you just email us or text us, we'll send it across.
Oh, thank you.
Brilliant.
So you would need our email address, or
I have put my our email address. It's info@arogyamuk.org. It's in the chat box.
Okay.
If you just email me, I can revert back with the recordings.
Thank you so much. Thank you.
I was just wondering if there is time and no other questions, could the doctor repeat that technique again? Because more people have joined and that was a very useful technique. Thank you.
Yeah, I don't know whether there's time. It's 7 o'clock, so I don't know how Nehaji's wanting to do it.
No, I'm okay as far as you're okay, Deepaji. So, I mean, it's your time.
No, if everybody wants to learn, we can do it once more, the pain technique.
Yes,
It's
please.
really simple.
Yes, we'll have a quick revision in that way then.
You want a review of it? Yes. Okay, so basically, it's an individual self-therapy. You focus on your pain, wherever the pain is, and give it a rating between 1 and 10. So you rate your own pain. How intense is your pain right now? So think about it. And then after thinking about it, tap the left inside of your hand. So this is where we do the karate chop. It's the inside of the hand, the middle of the inside of the hand, like that. Tap it 5-10 times firmly, thinking of your pain. Then tap the other side. You can do both hands, but even one hand will be sufficient. If you're in a hurry, you can just do one hand. Then tap below your nose and think of your pain. 5-10 times below the nose, and then below your chin, in the middle of the chin here, 5-10 times. Okay, and then tap on the back of the on the back of your hand, between the ring and little finger, in the middle of the back section here. It's called the gamut point. It's a triple warmer point, actually. This is where the magic happens. So tap it about 50 times or for 30 seconds. Roughly 30 seconds on either hand. You can do one hand, you can flip to the other hand if you get tired. You can do both hands like that. Okay, about 50 times minimum for about 30 seconds. And then you tap below the collarbone. So the collarbone is the, the firm bone here, just 1 inch below that. And the firm taps 5-10 times. Do some deep breaths if you can. This is a kidney 27 7 point. It's a kidney meridian point. Okay, it's the end of the kidney meridian. Okay, and then tap the back of your hand again, same point, gamut point, and this time close your eye. Then we're doing eye movements. Close your eye. Then open your eye and look down to the left, tapping here. Once you look down to the left, then look to the right. Look up your eye in one direction, full other direction in a full circle. Okay, whilst you're tapping. And then hum. And count 1, 2, 3, 4, 5 whilst you're tapping, and then hum again. And that's it. And then you rest and think of your pain again and see what's happened to it. You give yourself another score, and usually that score will have shifted by more than 2 points, or usually more than 2 points. But tell me if that's true or not, if people have tried it. That's my experience usually. And that's one cycle. So if nothing happens, you can repeat it once or twice again. Most people will see a shift. Okay, so that's the pain tapping. They call it pain tapping algorithm. Pain tapping routine from thought field therapy. There's another therapy called emotional freedom technique, which comes from thought field therapy, and that's a little bit longer, but it involves talking to yourself. I've not done that, but that is also very effective. So this is just something I've learned, and many years ago I learned this, and I found it useful to help many people with any sort of pain, whether it's chronic or acute. It helps you handle the pain. It will reduce your pain sensitivity.
Sorry, what's it called? Emotional talking. Is it emotional talking therapy, you said?
Field therapy. The technique I've just shown is from thought field therapy, TFT.
Yes. And then you mentioned about
this is from thought field therapy, but there's a similar therapy that's called emotional freedom technique, EFT. That has developed from TFT. It's like the second phase. Some other people have broadened it, and it's a slightly different one. It involves talking as well as tapping. But this one just involves focusing on your symptom and tapping, and you're trying to balance your meridian energies whilst thinking and accessing every single part of your brain. And that way your balance starts to come automatically. You don't have to say anything. That's the difference. So it's easier to, I find it easier to do, but it's a personal preference which one you want to do.
Thank
There
you.
are many techniques. But I'm sharing some of the things I've been, I've used it for my own pain. You know, I've used this when I've had an accident, when I'm on holiday. Once I injured my foot. It was so bad. I twisted it on a rock, on a beach or something, and I couldn't stand on it. And then I started doing this technique, and literally within 5 minutes, the pain shifted. It was bearable. I could walk. I could get on with my journey. It's so handy. It's you can use it almost anywhere without anything. You don't need anything. It's a handy little tool. But yeah.
I thoroughly enjoyed your session, Deepaji. I can't thank you enough. I think technology let us down a little, but it was amazing. And the things which I think no one tells us that we can self-manage, and with the simple tools like tapping and like emotion and switching, and the real scientific grounding behind. So I really appreciate your time and initiative you do for the community. But thank you so very much. I have shared all the details on the chat box. Please feel free to take the recordings and take the most benefit out of Deepaji's insight on the pain management. And we'll try the self-managed and less bothers GPs now on.
Thank you.
Thank you. On behalf of all of us today and Arogyam UK, I really appreciate and acknowledge all your support to the pain patients. And thank you for sharing this wonderful technique. And we all will practice, including all of us. Thank you. Thank you, everyone who could join us. Hopefully it was helpful, but feel free to request recordings. We all have done that. And we'll resume every Thursday, 6 to 7, with different techniques, with different therapies to support chronic pain, fibromyalgia, and chronic fatigue syndrome. Hope I'll see you next week, and next week again, the same time. Thank you, Deepaji. Thank you.
Thank you. Thanks so much.
Thank you.
Thank you, Doctor.
Thank you.
Thank you. Excellent.
So, we want to see everybody get better.
Thank you very much.
And you can get better. That's definitely true.
The best part is that you have given us the hope.
Thank you.
Thank you, Dr. Neha and Dr. Deepa. Thank you very much.
Thanks so much. Thank you.
Thank you.
Hello. Hello, Dr. Deepaji. I'm sorry, I was coming from London. I just arrived. That's why I joined.
Manjulaji. Oh, hello.
Because I went to celebrate Diwali with my younger son. So coming back, I really missed it. But the recording, is it that will be available?
Yes, yes, Manjulaji.
Okay. This now I will join regularly. But on the motorway, try to Zoom, but to 4G say it wasn't connecting properly.
Yeah, no, don't worry.
But it was.
Hope you're okay.
Thank you very
Lovely
much.
to see you. Yeah.